Hi, everybody. Welcome back to Health Confidential. I have an amazing guest today that's going to dispel so much and blow your mind while he's in the process. This is mainly for my Instagram audience that has been hounding me to talk more about cholesterol. Why? Because a few of the things that I've shared on Instagram have gone viral, and a lot of people are on statins, and a lot of people have actually suffered and had their loved ones suffer. So they want to have more information and more light be shed on what exactly is actually going on and why are people prescribing statins when in fact we could see that it's just leading to detriment. So I invited the one and only Dr. Stephen Hussey, who is, I'm actually one of his followers. He's one of the coolest, he's got one of the coolest pages on Instagram. So I highly, highly suggest you go follow him there. I wouldn't even be able to just to do justice to introducing him. So I'm gonna let him introduce himself. But I will say that he is a chiropractor, a functional medicine practitioner, and a health author who focuses extensively on cardiovascular health and the underlying causes of heart disease. He is the author of three health related books, namely The Health Evolution, Why Understanding Evolution is Key to Vibrant Health. So that's important because at least we know how we've evolved and why health is where it is. Understanding the Heart. So this is my favorite book of his, and I bought it on Audible. Surprising insights into the evolutionary origins of heart disease and why it matters. And I know that in this book, he explores the evolutionary and functional aspects of heart health, and he discusses why understanding the heart's origins, if you can believe that, not heart health origins, but the heart's origins, will actually help better health practices. And then the third book, Pain Sense, Revolutionary Insights into Human Physiology and How It Helps Us Understand and Eliminate Chronic Pain. Dr. Hussey, welcome to my show.
Thanks for having me. Happy to be here.
I'm very happy to have you because I mean, of course, I'm speaking from my own experience. I do love the content that you share. Very much interested in learning, not just for myself. So, for those of you that know me personally, back in 2011, I suffered a stroke. And of course, I didn't check any of the boxes of anything that they thought. I wasn't hypertensive, I wasn't overweight, I was actually an athlete. I still am, but at the time, I was even more into it more than I am now. So, I was fascinated by the whole idea that they put me on the same protocol that they put their older patients that are hypertensive and overweight, and yet they were not able to find the root cause of my stroke, especially because I was in my 30s and I was living a healthy life, really clean diet. So, of course, this kind of stuff fascinates me, especially because a lot of it is related to cholesterol. So, when it comes to heart health, cholesterol and statins are at the forefront of that whole thing. So, I wanted to see, I know that in your book, because I listened to it. So, in the book, Understanding the Heart, Uncommon Insights into Our Most Commonly Diseased Organ, you actually challenge the mainstream cardiology concept, especially the idea that the heart functions as a pump to move blood. And you sort of argue that blood can actually flow on its own
hmm
and that the heart actually just kind of directs it. It has more of a vortex role, um, helping slow down blood flow to meet the tissue's needs. I'm fascinated by that. Can you tell a little bit more about that? But before that, of course, tell us a little bit more where you practice and all of that good stuff.
Yeah, so I'm a chiropractor by training, and so most people would probably be like, "Well, what's a chiropractor doing talking about heart disease and heart health?" Well, I got really interested in heart disease because of my own personal health journey. I had a lot
Mhm.
of inflammatory conditions as a kid, and ultimately ended up with type 1 diabetes, which I was told my whole childhood that heavily predisposes me to heart disease. And
Mhm.
so I've always kind of had an interest in this. And so, you know, throughout college and then chiropractic school and very, lots of training in physiology. I have a master's degree in functional medicine as well. I always kind of perked up whenever there was talk about heart disease, but I never really got answers from that formal education, at least the answers I was looking for. And so I've always been very curious, and I always went to the literature and I went to reading books and different scientists' work, and I found a lot of very contrary things to what the general convention wisdom is about the heart and heart disease. I read a lot of different researchers, I guess, work, and and opinions about this. And there's a large body of evidence, like you're suggesting, that I write about in my book, that suggests the heart is not the main mover of the blood. And so, it doesn't make sense, from a just like a standpoint of, if I was going to put up or pump water up a hill, like you could think about it like from my feet back up to my heart. I wouldn't
Hmm.
put the pump at the top of the hill. I would put it at the bottom of the hill and pump it up, right? And so there's a lot of literature, probably over 200 years worth of literature suggesting that it's impossible for the heart to be this forceful pressure propulsion pump that's forcefully pushing blood around the body, that there's no way it could do that. And there's lots of experiments back from early scientists showing that it couldn't. If they set up a pressure propulsion pump system like the heart, it could not keep the blood moving through it like it's supposed to. And that's because that's not its job. And there's probably the most complete work that, with all the literature in it, showing or discussing this idea, is by a guy named Branko First, who's an anesthesiologist. He wrote a book called The Heart and Circulation, and it reads like a 200-page research paper if you're into that kind of thing. But it's a very good collection of all of the work that suggests the heart's not a pump, or not a pressure propulsion pump. So that begs the question of, well, what is the heart, right?
Exactly.
And why
Exactly.
is it important to understand what it is? And it's very important to understand what it is and what it does in the body, because when we talk about things like heart failure, we're blaming the heart for not doing its job. Well, what if its job was not to forcefully move blood? What if there are other things going wrong that are forcing the heart to be more of a pump than it's supposed to be? And that's why we're getting quote unquote heart failure. And so it turns out that the blood does indeed have mechanisms of moving on its own. And, I was taught in school that, yeah, you contract your muscles and that helps blood move. You have one-way valves in the veins and that helps the blood move in a certain direction. But there's more than that. So there's actually these mechanisms of what's called fourth phase water, or structured water, that occurs in the blood vessels, because the blood is about half water. And Dr. Gerald Pollack at the University of Washington has shown that anytime water gets next to a biological surface, it will structure itself into what's called structured water, or exclusion zone water, or bound water. There's lots of different names for it because lots of different scientists came across it at different times. But what this water is, it's called fourth phase water because it's not ice, it's not water, and it's not steam, but it's more like a gel. So you could think like the consistency of raw egg white, or almost like Jello. And so water can structure itself into this state, and they've actually shown that this does indeed happen on the lining of arteries in the body. And then when this happens, I mean, we can get into the details if you want, but structured water has unique properties, and it does a few different things. One of those things that it does is it actually creates mechanisms of blood flow, or create fluid flow. And they've done this experiment over and over again in Dr. Pollack's lab, where they have a tub of water and they put a tube made of a hydrophilic or water loving solution into the water, and they put infrared light. They add energy to the water, and the water starts to move through the tube with no pump or force acting on it at all.
Wow.
And so that's how the blood moves. And so that's the main way the blood moves. The heart does do a very small amount of quote unquote pumping, but it's no more than enough to kind of move the blood through the chambers of the heart itself. Once it gets out into the arteries, the blood moves via this mechanism of fourth phase water. And there's very recent papers from Dr. Pollack's lab showing that this is the case. And they suggest this alternate form of blood movement. So what is the heart then? Well, if you look at the heart, it's actually, there's a researcher from Spain named Francisco Torrent Quasp, who found that the heart is actually one big band of muscle that's wrapped up on itself. So when it
Right.
contracts, it actually spirals, like kind of like an American football, not like a basketball. So it spirals like that when it contracts. And there are many different times when, as the blood's moving through the heart, it's actually being vortexed or swished around, like spiraled. And so that's why the heart is there, because in Dr. Pollack's lab, they found that if you vortex or spiral water, it energizes it just like infrared light does. so that when it gets out into the arteries, it can form structured water and then propel itself through the arteries. So in a way, you could say the heart is kind of responsible for the movement of blood, just not in the forceful pressure propulsion pump way that we think of. So it's this vortex, this vortexing device, which makes sense because that's the way fluid is in nature. Fluid is not sitting still. It's always being swished around. It's always rushing over rocks and waterfalls and rivers. It's crashing on the beach. It's tidal currents. It's being evaporated and precipitated. Like water is always being moved and swished around. And so when you get water moving through a laminar tube like an artery, it needs to be swished around. And so that's why the heart is there in the middle of it to create that turbulence so that we can energize the water. So that's the first reason the heart is there. The second reason is because if during exertion, if we exercise, the tissue demand for oxygen and nutrients is so high that the blood would rush over to the arterial side trying to deliver those nutrients to the tissue. And it would do so extensively that the venous side wouldn't have enough fluid in the system and it would collapse. And so if the heart wasn't there to actually slow the flow of blood, because there's research that shows that when during exertion, the heart is actually impeding the flow of blood, it's slowing it down. And so when it slows it, it helps maintain the pressure, hydraulic pressure between the two systems so that we don't die. So that's the second role of the heart, is that it helps slow the flow of blood during exertion. And then, and that's interesting. They've done those experiments on like endurance athletes, and they show that in endurance athletes, the heart can become bigger because it's more effective at stopping the flow of blood, not that it's forcefully pressure propulsion pumping it out of the heart. So it's interesting. And then the third role of the heart is it actually measures what's called coherence in the body. So coherence is basically how synced up and communicating our body is to its internal environment, so cell-to-cell communication, but also our external environment, how synced up we are to our communities and things like that. And so the heart has the highest electromagnetic field of any organ in the body for two reasons. One, it's very dense in mitochondria, which mitochondria can create small electromagnetic fields, and then a bunch of mitochondria can create a bigger electromagnetic field. And then when you spiral that, like the heart is doing, it's spiraling, it amplifies the field. So that's why the heart has the giant electromagnetic field, and it's the only organ that can touch or sense every single cell in the body. So like it's monitoring how well all the cells in the body are synced up and all the organs in the body are synced up and communicating electromagnetically. And this is a lot of the work that's been done by the people at the Heart Math Institute, but many others have done this work too. And so the heart is the measure of coherence, and based on how coherent our body is, the heart is relaying that information to the brain, so the brain can send a signal down to the body to respond accordingly. But those are the three roles of the heart. Those are the three functions of the heart. And you ask most people in the modern medical world, they're not really aware of those things, but they're very important to understand when we're trying to figure out why the heart may, quote unquote, fail in those situations.
That is so fascinating. And I mean, thank you for going in detail so that people can understand exactly, the why and the how behind it. And thinking of what you said about the vortex of the water. So Dr. Zach Bush actually spoke about this as well. And he was saying that if you watch nature, and I'm actually a huge fan of that, because nature can teach us so much just by doing nothing, but by just simply being and expressing itself. And he said, if you ever look at a cat, it will not drink water out of like stagnant water out of any kind of vessel. However, you will see that they get very animated and would actually drink water out of a toilet when you flush it, because the flushing has that vortex motion, and that's what they respond to. So he said that we could watch animals and we could watch how they interact and interface with moving water bodies. So I loved what you said about that, and certainly it speaks to. And I know he also spoke about the fact that water is actually more of a gelatinous substance, and that's what the cells are looking for, rather than the liquid water that we see coming out of the municipal tap and all of that. So let's talk about cholesterol, because I know that's what the audience wants to learn about. So you spoke that you were diagnosed with type 1 diabetes. which is not like type 2, that in the sense that it's not reliant on your diet, but rather that your pancreas is not able um, to produce the insulin. Have you reversed that? Are you still afflicted with that?
No, I have type 1 diabetes, and the collateral damage that was done from that will be there. Now, there's lots of different, I guess, types of type 1 diabetes, or different subsets of type 1 diabetes that we're finding out. And so I do know of people that get later onset type 1 diabetes and change their diet and completely control it that way and don't have to use insulin. And I've heard of kids who were diagnosed at young ages, and if they intervene soon enough, where some of the cells are still alive, they can reverse the process and not become type 1 diabetic.
Right.
I didn't know that when I was 9 years old and got diagnosed, and my parents didn't know that. So as far as I know, I manage it very well, and I change diet, and it makes it easier. But yeah, it will be there as far as I'm concerned, unless there's some stem cell cure that's invented, which has actually happened in China in trials. So there's hope.
Absolutely. And of course, I mean, I'm a big proponent of using food to be able to manipulate how the tissues and the body responds. And of course, there's just so much information out there. People would just not have the time to learn it to that depth. But it is fascinating that you're learning exactly how to do that. Um, so the heart attack that you talked about, how old were you when that happened?
I had a heart attack at age 34.
Okay, 34. And what did mainstream medicine say that that was attributed to?
They said, "Oh, cholesterol causes heart attacks." It was cholesterol. That was the answer, like a broken record I got in the
Of
hospital.
course.
Yeah.
Of course, just like I did when I had the stroke. It was the
Hmm.
usual. "Yeah, you probably have high blood pressure." When I could barely get it over 100. um, okay, so uh, did you have were any of your levels outside what the norm calls for? Your LDL, your HDL?
Yes, very much so. They were.
Okay. And was that attributed to, because I know that, so cholesterol, all the cholesterol that we need, the body makes, the liver.
Hmm.
And yet, a lot of people believe that they have to eat certain something or other, or not eat something or other, such as fat, out of fear that it's actually the fat that deposits on the arteries or the blood vessels, and that's what leads to the heart attack. So if your levels were off, so outside the norm ranges, what exactly were they telling you? They were telling you that what you eat too much fat and that's why? Or is it that were they saying that your liver is broken because it's not producing?
I mean, they just told me, like, at that point, like, I had a heart attack, and I'm like, "Okay, guys, what happened? Tell me about it." And they would just say, "Oh, it's because cholesterol. Your cholesterol is high. That caused the blockage, and now you have a heart attack. You had a heart attack." Um, and so, but let's back up. So first of all, there's never really been any evidence that cholesterol causes heart disease. Yes, people can go find studies that are heavily pharmaceutical funded,
That's right.
and there's plenty of evidence that authors of these studies have been paid by pharmaceutical companies to say that higher cholesterol causes heart disease and causes heart attacks. Because if you can convince the society of that, you can sell a lot more cholesterol lowering medications. And that is not conspiracy. That is very well documented that that is the case. That is what happened. If you look at the history of heart disease, like back in the early 1900s, heart disease was not really a thing. There was no, field of cardiology. There was no American Heart Association because coronary artery disease was not prevalent. And then, like in the late 40s and 50s, it started to rise a little bit. And then President Eisenhower had a heart attack while he was president, and everybody was starting to get worried about this disease, this new thing. And people didn't know what it was. And this guy, the scientist named Ansel Keys, came up with a theory. And basically, what he did is he looked at the amount of cholesterol and saturated fat that people ate in their diets in different countries, and he compared that to the rates of heart disease in those countries. And he found there was a correlation that if you ate more cholesterol and saturated fat, then there was more heart disease in that country. However, there was data from 22 countries available at the time, and he used the data from the 7 countries that gave him the correlation that he wanted. So basically, he cherry picked the data. He picked the
Oh,
ones that only gave him what he wanted to see. Later, 2 scientists repeated the study and used the data from all 22 countries available and found no correlation whatsoever. However, there was a lot of money behind this theory, like I mentioned. If you can convince society that saturated fat and cholesterol is bad for you, you can sell a lot more cereal and sugary laden foods, right? So the food industry backed this theory. If you can convince people that cholesterol in the blood is bad for you, then you can sell a lot more drugs. And so the pharmaceutical industry put a lot of money behind this theory. And all the way up until 1984, there was not consensus about this. But in 1984, they put together this committee, and this committee was influenced very heavily by pharmaceutical companies through money, and they incorrectly decided that LDL in the blood causes heart disease and was bad for you. And since that time, they started to put together little other committees that go and educate doctors about how to lower cholesterol with medications and how that was the best thing to do going forward. However, um, that was all very fraudulent, right? It was not backed by science, it was backed by money. And so then, if you kind of fast forward, heart disease is still the #1 killer in the world, despite statin drugs being the #1 or 2 prescribed drug in the world every year. It's not really helping. So when I'm sitting in the hospital and they're telling me it's cholesterol, I know that the history doesn't suggest that, but I also know that there's lots of evidence that it's not. If you look at modern day studies, there's just as many studies that show that cholesterol does not cause heart disease as there is that says it does. And it depends on how you design the study. And lots of these studies are the lowest form of research there is. They're epidemiology. And by the way, back when the theory first came out, Ansel Keys and many other scientists, there was probably like 5 or 6 big studies that happened where they replaced cholesterol and saturated fat in the diet with unsaturated fat in the diet. And the people who ate more unsaturated fat, they all had higher rates of heart disease and higher rates of death, the more unsaturated fat they ate. However, the results of those studies were kind of pushed under the rug, and they weren't published for up to 16 years afterwards. They left data out that made them look better than they actually were, or worse than they actually were. And so there was a lot of nefarious activity around this theory because there was lots of money behind it. So people are probably wondering, well, what caused my heart attack? And we'll get there. We'll get to that. But we have to finish this cholesterol story. So what does cholesterol actually tell us? Why are we obsessed with measuring it? And there's new literature coming out in people who eat lower carb diets, lower carbohydrate diets. And some of them, they're calling them lean mass hyperresponders. And some of those people, when they go low carb, their LDL can go way up. And the reason that is because when you restrict glucose, when you restrict carbohydrates from your diet, your body's choice is to burn fats. And fats are delivered to tissues through LDL molecules. So if your body needs to burn more fat, it's going to have higher LDL molecules delivering those to the tissues. If you eat more glucose, your body will burn glucose, and it always burns glucose first if it's present. Most tissues in the body will do that. So it'll lower the LDL, and you'll burn more glucose. And that's what's happening when you restrict carbohydrate. These lean mass hyperresponders, which I'm one of them, or I have numbers kind of like them. When I restrict carbohydrates, which is what I was doing, my LDL was high. But it's always in the context of good metabolic health, good insulin sensitivity, low inflammation, all this kind of stuff. These other cardiometabolic, good cardiometabolic numbers. And so there's an interesting study, or it was just an experiment done by one researcher at Harvard, where he's one of these people who eats a low carb diet and his LDL goes up. And what he did was he went on that diet, his LDL went up, and then he ate 12 Oreo cookies for 6 days in a row. And his LDL plummeted. It came way down. And then he went back on his low carb diet for 6 days, and his LDL went back up. And then he took a statin drug for 6 days, and his LDL went down. But the Oreos work significantly better than the statin drug because this is about metabolism. What your lipids in your blood are telling you is about what you're metabolizing at the time, which makes sense. They're carrying fats. That's part of metabolism. There's really no indication of risk from what LDL is. And I'll show you, I'll continue with my story and to help illustrate that. So in my opinion, I mean, no one will ever really be able to tell me exactly, including myself, what caused my heart attack. But when you look at the literature, clotting tissue, whether it's atherosclerosis or a heart attack, is made. These things are made up of clotting tissue. This is when spontaneous clotting happens in the body. It can happen chronically. You can develop atherosclerosis over time,
Mm-hmm.
or you can, in my case, a clot that can form large enough. If you get yourself into a certain situation, it can form this large enough to block the entire artery instantaneously. And that was the case for me because I had a CAC score done, which is a measure of calcified plaque in your arteries. And it was done 6 months prior to my heart attack. And it was 0. It was a perfect score. There was no calcified plaque in my arteries. And that doesn't tell you anything about soft plaque, but that's usually a good indicator of cardiac risk. And mine was perfect. And I still had a heart attack. And so it's this clotting material that happens. And so when I say clotting material, it's the same type of thing that if I cut my skin, a scab forms, a clot forms to stop the bleeding because my
That's right.
body can't heal it instantly. So it has to stop bleeding so they can heal it over time. And if my arteries get damaged, the same kind of thing can happen. If it's just low grade damage, then the body deposits clotting tissue, and that can, if it doesn't heal itself, build up and form atherosclerosis and this narrowing of an artery. Or you can get yourself into a situation like I did, where a spontaneous clot can form instantaneously, and it's large enough that it blocks an artery. And the reason this happens most commonly in the coronary arteries is because they're under the arteries under the most pressure. So if there are things that are causing damage to arteries, they're getting pushed up against the walls of those blood vessels much more forcefully than any arteries in the body, especially the left anterior descending artery, which is where most heart attacks occur. It's where mine
Mm-hmm.
was. And so this is about preventing clotting. And clotting in our arteries is caused by imbalances like damage to the lining of the artery, when we get poor or stagnant blood flow, when we get blood that's too sticky or viscous, too viscous, those things predispose us to clotting. And the reason that we have a society that's so predisposed to clotting and has this epidemic of heart disease is because we're removing the things that protect the lining of the artery. We're adding a bunch of things that insult the lining of the artery, processed foods, toxin exposures, lots of different things like that. And then when we're removing, we've also interfered with the ability of the arteries to heal themselves. When we create poor metabolic health and we create disrupted circadian rhythm, those types of things, those are the things that allow us to heal the lining of the artery. And if we disrupt those things, then we can't heal them. So we take away the protection, we add the things that damage, and we interfere with the healing. And that's what's going on. So that's what's, and we can talk about specifically what those things are. But that's largely why we have vascular disease. It has nothing to do with cholesterol. And if you look at studies in people with genetically high cholesterol, familial hypercholesterolemia, these people have astronomically high, quote unquote, high levels of cholesterol.
Yes.
And some of them in those studies get atherosclerosis and some of them don't. So it's clearly not the high cholesterol that's causing it because some get it and some don't. So if they looked at those people and they studied them, they find that the people who got atherosclerosis were the people who also had genetically higher risk factors for clotting. They have higher numbers of prothrombin or factor VIII or fibrinogen or things like that. So this is all about clotting and the risk of clotting that's happening. And so I'll stop there, but people will probably want to get into how we prevent clotting. But yeah.
Yeah, because I saw most of the questions that I get about the familial, especially about the familial high cholesterol, is that, oh, my LDL is so high. Oh, my LDL is always so high. Um, I should just say, hey, you should just eat some Oreo cookies and then test it again. But that's crazy because I know that the pharmaceutical industries probably wanted to provide something. But I mean, if you want to do a test, whoever's listening, go and try to do that test on your own to see if that's going to change anything. But let's talk about, because I know that one of the things that I try to drive home when I talk to people about this is what exactly is causing all that damage to the internal lining of the blood vessels. What exactly are you doing through your diet and your lifestyle to cause that damage that will necessitate your body to then go and try to put something to patch it up? So can you talk a little bit about that?
Definitely. So we've already talked about structured water
Yeah.
and it forming on the lining of the arteries and that creating blood flow, right? So
Hmm.
way back in 1856, Rudolf Virchow found that the things that cause clotting are when we get damage to the lining of an artery, when we get poor stagnant blood flow, and when we get blood that's too sticky. And so if you look at what structured water does, it forms on the lining of the artery, or it's supposed to form on the lining of the artery. And another name for structured water is exclusion zone water, because one of its properties is that it nothing can penetrate it. It's kind of this thing that this barrier that sets up there. So if you put a barrier there, nothing's going to damage the lining of the artery. But if you remove the barrier, it's vulnerable to damage. We already talked about how the structured water is what promotes blood flow. And so that's how
Okay.
you keep blood moving, keep it from being stagnant. And structured water also forms on the lining of red blood cells and lipoproteins. And anything in the blood, really. And when it forms around it, then the structured water makes them kind of like bumper boats. So they don't get stuck together and coagulate. They stay evenly spaced and they bump off each other and nothing really gets sticky. And so that's how you prevent clotting. And the number one way to build this structured water in the vascular system is infrared light exposure. Infrared
Okay.
light is what they found in Dr. Pollack's lab that would build structured water the most. And so, why does that make sense? Why does that make sense with our epidemic of heart disease? If you look at least in America, when you look at when the real rise of heart disease started, it was 1940s, 1950s. It was coming up a little bit before then, but it really shot up in the 40s and 50s, and that's exactly when fluorescent lights were invented. And
Oh,
so
wow.
we replaced incandescent bulbs and firelight and being outside in sunlight with being indoors under artificial light. Now we had these bright lights. We could live indoors and we could be up at all hours of the night under this artificial light. And we've really removed ourselves from that infrared light exposure. So now we're not getting the protection of structured water. We're not getting the adequate blood flow, the less sticky blood because we're not under this artificial or we're not under this infrared light. So that was removal of the protection. Then in the 50s, we also started eating more processed foods, way more processed foods, and more toxins were added to the foods. We started getting more toxin exposure, and that started back in the Industrial Revolution, toxin exposures. But we started getting way more toxin exposures, lots of herbicides and pesticides, things like that, especially glyphosate. Lots of different things that have been shown to damage, lots more plastics. Plastic is a huge issue as far they found plastic buildup in atherosclerosis, like it's there damaging the artery. So all these exposures we've created, um, uh, we take away the protection and then we add these insults, right? And then um, when we have this damage, the body says, okay, well, we got to heal this. But first, we got to stop it from the artery from rupturing. Because if it gets damaged too much, the artery is going to rupture. And then we're internally bleeding. That's not good. So it deposits this clotting material, this plaque, so to speak, to patch it up. But the problem is we've interfered with the body's ability to heal the artery. So the plaque just stays there. And then more damage happens and plaque starts to build up. And then we get this stenosis of an artery. And the reason that we've impaired the ability of the body to heal is because our circadian rhythm is disrupted, which also has to do with artificial light, because circadian rhythm is how synced up to the day-night cycle you are. And if you have artificial light, artificial blue light after sunset, which comes from screens and LED bulbs and things like that, then that's telling your body it's daytime. And when you do that, you interfere with proper sleeping and melatonin production and proper sleeping and the deep restorative healing sleep that's supposed to happen every single night. And there's plenty of literature that shows that the vascular system heals at night with adequate melatonin levels. And so if you interfere with that healing process, now the damage has happened, can't be healed, and it continues to get worse and worse and worse. So that is kind of the three-pronged approach as to what's causing this damage and how the body's reacting to it. The body's doing exactly what it's supposed to do in the environment that it's in. If we want it to do something different, we have to change our environment, give it different signals to do so. And I want to tell a story that shows the power of that.
Yes, please.
So I had the heart attack, obviously, and they prescribed 11 different medications while I was in the hospital. They told me I'd be on 5 of them the rest of my life. And I'm not saying this is medical advice or anything, but I took a blood thinner for 6 months and that's it, because there was a stent in my heart now, and I wanted to make sure that didn't cause any clotting issues. So I took a blood thinner for 6 months. And that's it. I'm not on any medications anymore. And 3 months after my heart attack, I started doing, my diet stayed the same. It was very low carb, low animal based. My LDL stayed the same this entire time. And my stress, unfortunately, stayed about the same, I think. But what I added was infrared sauna, grounding, and sunlight exposure. I increased my sunlight exposure significantly, and I optimized my circadian rhythm. Those are the only things that I really changed. I did take a supplement called serapeptase for about a year, but at the 3-month follow-up, my heart had returned to normal because there was some damage to the septum, the middle muscle of my heart, and then my ejection fraction was lower. It was about 35%. It's supposed to be 50 to 70. And so it had improved to normal. And they said, oh, you must have decided to take your medications. And I was like, actually, I
No.
didn't, and then this is just my experience. I'm not saying this would happen for everybody. But then because of they had to go place a stent, they had to go bust the clot and place a stent. So they went in to do that through the artery in my leg, in my groin. And so they punctured the artery, went in there to do that. And when they came out, they placed this device called an angioseal device around the artery to help it heal. And that device, I found in the literature, has been shown to interrupt or change the blood flow dynamics into the leg and cause issues. And so about 3 months after, around the time I got that clear scan for my heart, I started recognizing that I was trying to walk more and be active again, and I was getting pain in my lower leg because there was atherosclerosis there, and it was restricting blood flow to my leg. So I couldn't run, I couldn't walk fast to the airport, I couldn't snowboard, I couldn't play soccer. I was getting pain because of this intervention they did. And I'm grateful for the intervention. Obviously, they saved my life. I can't say that it was, I can't be regretful of it, but it did cause this issue. And so I had a 75 to 99% blockage of the artery in my leg, and it was restricting blood flow to my lower leg. And so my lower leg became very painful if I would exert myself. So we decided, the vascular surgeon said, well, we're not going to mess with it because when we start messing with it, they usually get worse. And I'm type 1 diabetic, which is type 1 diabetics do very poorly with peripheral artery disease, which is what this was. But I want people to recognize that it wasn't cholesterol that caused this. It was a change in blood flow dynamics created by that device, which created clotting. Because my LDL had been high for a long time and it wasn't there before. And so, anyways, so we didn't do anything. And I went home and started using the sauna more and grounding and circadian rhythm and sunlight and all this stuff. And a year later, I came back and the test had dropped to only 50% blocked. And at the time, the vascular surgeon said, well, we can't say it's better because these things just don't get better. And I was like, well, I mean, it's getting better. I mean, we see it on the testing, right? And so then I kept doing that stuff and did it for another year. And another year follow-up, the artery was completely normal. There was no atherosclerosis.
Wow.
And that, if you ask vascular surgeons, that is impossible. Type 1 diabetics cannot reverse peripheral artery disease. And I did.
Wow.
And I didn't know that I was going to, but doing these things, I did. And I did it using infrared light and protecting my arteries that way. And then a year later, I did another follow-up and it's still normal. I can run now. I can walk with no pain in my leg.
That's
And
amazing.
I did that. And this is the important thing. I did that with LDL levels astronomically higher than they say that should be. So if those things are so causative in heart disease, how was I able to completely reverse plaque in an artery in my leg with high levels like that?
While maintaining a high LDL.
Right.
Can you give us a number for the US audience? Because I know that in Canada and in Australia, because people DM me all the time to say, hey, what number is this? Or when they say 220, what is
Mhm.
that in? Because we don't run by those numbers. So what was your
Yeah.
LDL at?
Well, yeah, like so in American numbers or US numbers, the like total cholesterol is supposed to be 200 or lower, and LDL is supposed to be 100 or lower. That's what they say.
Yes.
I don't buy it. But mine was pretty consistently, the LDL was 200 or higher. And toward the end, toward that last year when I maintained the normal artery, it was over 300. Um, the LDL was over 300. And then the last test I took, it was over 400. So very, very
Wow.
high. Like they would
Yes.
consider me familial hypercholesterolemia if they looked at it in that way. But in reality, I'm just eating very, very low carbohydrate because it's very easy to manage type 1 diabetes, very low carbohydrate. And so I'm burning more fat and that's delivering fat. And there's other nuanced things there, but it really is just telling me about metabolism. And so, I'm just an N of one experiment. It's just an interesting observation, but my my techniques that I use to reverse this warrant investigation. And it basically shows that this LDL molecule and this cholesterol, these lipoproteins that carry cholesterol around the blood, are definitely not the only factor or even play a role in heart disease. And so the literature suggests that, my experience suggests that, and I think that they have been a giant distraction from the actual causes of heart disease. And the actual causes are what I laid out for you there, as far as like the infrared light, the toxin exposures, and the disrupted circadian rhythm and things like that. And we need a entirely new approach to heart disease, because just micromanaging and overanalyzing cholesterol numbers, no matter how you slice it up, like oxidized LDL, small dense particles, ApoB, everybody wants to argue about that stuff. And that's just the same level of thinking that created the problem in the first place. We have to think beyond blood chemistry as to what's causing this condition, and really try and get it out there and help people, because they're lost. Just like people are reaching out to you, they're so bogged down in this, they don't know what to do. They're so confused, all these different opinions. When in reality, it's higher than that. It's much bigger than that, and we have the power to reverse it ourselves, in my opinion.
I know, and all of my content that I post on Instagram, I don't know how many people actually read the captions that take me so much time to put together, but I always say if medicine had it right, we would not be getting sicker. In fact, rates should be gone altogether. Not even minuscule numbers, but gone altogether. And yet we're sicker than ever.
Hmm.
And a couple of the reels that I shared, people were talking about how many of their loved ones had been on statins for extended periods of time, ended up with dementia and Alzheimer's, just destroyed brains. And they were at a loss because they said, well, I wouldn't have ever actually traded the cholesterol for for the dementia or for the
Hmm.
Alzheimer's.
Hmm.
So, and even what you said, a lot of that, what you described there, even the tests and all of that, how do they have it so wrong? And why
Yeah.
are they continuing to keep with the same tests, with the same approaches, with the same solutions? Of course, we understand why that is the case. When such simple lifestyle changes, such as what you described, are so efficient, and you would be able to lower your numbers, or at the very least eliminate the issues that you are facing, but the
Hmm.
doctors would never even admit
No.
to that.
Well, it's just what they're taught. It's what they're told. And the standard of care is that if you get someone's blood work and this is what it says, then you have to prescribe a statin. And
Yeah,
if you don't, that's against the standard of care and you're liable for that. But I also know, because I've talked to many physicians, that they get pressure,
yeah,
from their businesses, because if they prescribe so much of a thing, then the business gets a bonus. And people say, "Oh, that's not true. They don't do that." And it's just like there's documentation of people getting money from pharmaceutical industry, like billions of dollars that pharmaceutical industry gives out to physicians and to medical practices and things like that. And so the system is set up against change, right? Because if the physician even learns the things that I've learned, they can't. It's like there's things that are preventing them from fully going away from that. And so that's just the system that we're in. But to talk about statins, because lots of people will say, well, what about all these clinical trials? that show that
Yes.
statins are beneficial. We're talking about the Jupiter trial, the Ascot trial, the West of Scotland trial, the 4S trial. There's lots of different these major clinical trials that they tested the benefits of statins. And you have to look at them in the context of the statistics. And what they've done is they mess with statistics. Lots of times they stop the trials early, like in the Jupiter trial. They stopped the trial early, and at the time they stopped the trial, there was just as many adverse events, strokes or heart attacks in the treatment group as there were in the non-treatment group. So that doesn't really make sense. But what they'll say is like in the Ascot trial, there was a headline that came out after that trial was done that was like statins, I think it was rosuvastatin, decreases heart attack risk by 36%. That was what they said. And so if you look at the actual difference between the treatment group and the control group, so the treatment group was taking a statin, the control group not taking a statin, it was 1% difference.
Oh my
So
God.
98% of the people taking a statin did not have a heart attack or a cardiac event, and 97% of the people who did not take a statin. So there's a 1% difference, which is there's no difference pretty much. It's statistically insignificant. However, the absolute risk of that is 1% difference, right? But the relative risk, if you take they take the 1% difference multiplied by the 3% of people who did have a heart attack or risk not taking the drug, and they multiply those together, that's the relative risk, the risk relative to the non-treatment group. And so if you report it as that, you get 36%, right? And so that's what they're touting. They're saying, and it says it right there in the headline, it says 36% reduction in heart attack risk by taking rosuvastatin. And then in the fine print, it says the actual difference is 1%. But nobody reads that,
Oh,
you know? And so they're touted as these miracle drugs. But if you report it, if you actually do the right statistics, which I don't even know why relative risk is the thing, but if you actually do the absolute risk, they're not beneficial. And there was actually a study that came out in 2020 that looked at all those major statin trials, and they looked at them in relative risk rather than or absolute risk rather than relative risk, and they found there's really no benefit. The mild benefits you do get is this mild, or the slightly anti-inflammatory effect. But I'd much rather get an anti-inflammatory effect from grounding or from infrared light than from a drug that has been shown to cause diabetes and increase risk of vascular calcification and cause sexual dysfunction and cognitive decline and muscle pain. These are all the things that statins have been shown in the literature to cause. And so, they show that sometimes the studies may show that there's a decreased risk of cardiovascular death, but there's an increased risk of dying of something else. So it's like, great, you died with low cholesterol, but you achieved low cholesterol, but you died of cognitive decline, or you died of cancer or whatever. It's like, great, super. Like, that's not the end goal. Like, look at all cause mortality. That's the important factor that we're looking at here. And so the statistics are heavily manipulated in those studies.
right.
And we have to take that into account. Disease is not a medication deficiency. It's an environment. It's your body getting the wrong signals from the environment. So we have to change the environment.
So then diet, because you said, so you are, would you say keto?
Yeah, I'm at this point, I diet is incredibly important for health, but
Yes.
I don't think that it is the thing that causes or prevents heart disease. Um,
Okay.
yeah, I do think that being metabolically healthy is important, and
Mhm.
that could be many different types of diets. And I do think that getting adequate nutrients from our food is important, which to me, animal foods are the most bioavailable source of nutrients. But it doesn't mean we can't eat plants. But it just means that those are the most bioavailable. So that's what's important when it comes to diet. Is it giving you metabolic health? Is it giving you enough nutrients? But I do not think that eating a certain diet is going to prevent you from heart disease. Whether that's a vegan diet or a paleo diet or a carnivore diet, it's not going to, because it's not the only thing that plays a role. Now, if you're eating a processed food diet, standard American diet, yes, that's going to add to inflammation that will contribute to heart disease, but it's not the only cause. The lack of infrared light is also predisposing you. The disrupted circadian rhythm is also predisposing you. It's very multifactorial. And that's what we have to look at. We have to look at dental health when we talk about heart disease. We have to look about toxin exposure. We have to look at so many different things. And just thinking I'm eating a heart healthy diet and I'm safe is not the right mentality. And that's what it's simplified down to. And because there's so much conversation about cholesterol, then the conversation about heart disease becomes about diet because cholesterol is in our diets, or it could be, and it's just been, again, a distraction. I mean, diet is very important for health. However, I don't think it is what's driving or preventing the main preventer of heart disease.
I love what you said about the circadian rhythm and the infrared red light, and because I know that there's such a correlation to heart attacks for women who are in menopause,
Mhm,
and or not necessarily menopause, but even perimenopause, because one of the things that gets disrupted is sleep. So that speaks to what you were saying about the melatonin,
mhm,
the fact that the circadian rhythm is completely thrown off.
mhm.
Um, but again, I mean, there are many driving factors behind that. But I just
Yeah.
wanted to try to piece this together because I got a lot of flack when one of the first reels that I shared that went viral was by Dr. Al Huggins, who was a dentist, and
Mhm,
he was talking about this. And I mean, the entire lecture is on YouTube. And I went and I grabbed a piece of it from there and I shared it, and people went crazy. Oh, he's a dentist. What does he know? He has no idea what he's talking about. He should stick to teeth. How can he
mhm,
know how cholesterol works? Um, so a lot of people are so used to exactly the way that the medical system actually works. Like everything is, we have specialists, everything is in
mhm,
silos. So every organ system does its own thing, outside. It has no connection to the other organ systems, it has no connection to the other tissues. And so a lot of people believe that, a cardiologist would be able to give them all the answers related to it, when in fact, a cardiologist would probably never speak about grounding.
mhm,
Cardiologists would never speak about the circadian rhythm. Maybe now, especially because you being out there, you actually put this message out. You obviously have books out, so perhaps it's going to catch slowly. But it's really important that people understand that to, at the very least, go and ask informed questions
mhm.
to say,
Definitely.
what do you think about this? Or, well, I heard this from this doctor, and um, what if that's the case? Because you put me on a statin and nothing happened, or you put me on a statin and my cognitive function is decreasing. So I wanted to touch on not only on the diet, because I know that people are so bought into the idea that what they eat is the only thing. They don't pay any attention to the stress levels in their life, which drives inflammation up. They don't think about lifestyle at all. They think that they could be going. I mean, at the time when I had my stroke, I was going through divorce.
Mhm,
So, of course, that would be probably one of the main factors that led to that. The inflammation alone that probably caused was. But they were looking at numbers. They put me, just like they put you on a blood thinner. They put me on a blood thinner, and then when I went back to school, I actually realized, hey, you know what? There are actual herbs that you could do that with.
mhm.
You don't have to ever do any kind of meds. But they said, no, you're going to have to be on Coumadin and on the baby aspirin, the little one that had 81 milligrams for the rest of your life. So,
Yeah. Well, the difference is like biochemically, you can thin the blood by interfering with clotting factors. There's this whole clotting cascade that's supposed to happen when our body wants to develop a clot. Sometimes
right.
it needs to, and those drugs interfere with that clotting cascade biochemically. Or you could thin the blood biophysically. Biophysics meaning build structured water. Like how do we create less viscous blood? We build structured water, create zeta potential around the blood cells, keep them evenly spaced. That's how we create less viscous blood. Um, but there's lots of different things. Magnesium in and of itself has been shown to be a very
Yes.
effective blood thinner. There's even studies that intravenous magnesium was just as effective at blood thinners at preventing clots after stent placement in animal models. So I'm not saying that that's what you should do in the hospital because they don't have those protocols and stuff, but there are different ways. It's just that it's not being explored or entertained by the medical system, that there's these other ways, because the drugs are what make them the money. So that's what
Of
they'll
course.
use. But if you biochemically interfere with blood clotting, then you're putting yourself at risk for bleeding, GI bleeding, bleeding out if you get injured, like lots of different stuff.
Yeah, I actually had another doctor, a naturopathic doctor, who her whole thing is magnesium. And she talked about how if you were to go and get a test done and they test and they say, oh, yeah, your magnesium is fine, it's never fine,
Mm-hmm.
ever. I mean, everybody's magnesium deficient. And she said they will tell you that it's fine and it's never, ever fine.
Mm-hmm.
So, and I appreciate
Yeah.
what you said about the fact that it's a blood thinner. Um, so then let's talk a little bit about structured water because I mean I'm fascinated. I'm sure a lot of people are probably going to be thinking about. So I'm trying to get this girl that water and structuring water is her whole thing. What are some of the things that people can do? What products can they use to structure their water? I know that it has the vortex, so there are certain products out there that can actually help vortex the water. And there are certain things that are literally would cost you no money, just a spoon, and you just stir your water before you drink
Mm-hmm.
it. And if you want to do at least a little bit of, um, like get some sort of benefit from it. But tell us a little bit about that.
Yeah. So Um, you can't, in my opinion, you can't really drink structured water, because if it was structured, it'd be like a gel and you'd be like drinking Jello,
Right.
right?
Right.
But you can create water that is healthy and coherent and energized so that when it gets into your body, it will more likely structure itself. And so that means um, the water needs to be toxin free. So, like a reverse osmosis filter would be great, but you always want to add minerals back to that,
Yeah.
because water is supposed to have minerals with it. That's the way it comes in nature. And that's the way it is in your body.
Yeah.
Like the salinity of the blood is like the ocean, very, very salty. So we need to add minerals back. And then, yes, you need to do something that increases the coherence of water, energizes water. You could put it out in the sun. You could vortex it, like you're saying. You could stir it around. There's like the analemma wand that you can use, or I mean, literally the most low tech is just take the glass and do this, swirl it
Shake it.
around.
Yeah.
Yeah, you could shake it. If you put it in a glass bottle and you shake it, you could put it in contact with the air somehow, but then it gets dirty. So those types of things, to energize the water, um, would be helpful. And so that when you drink it, it structures itself. But also remember that when you drink water, ideally, it's clean and it's mineral rich. You can also do things to your body that will increase the structured water. And so that is infrared light, which is the sunlight. I mean, the sun is always 40 to 50% infrared light, but you could use infrared saunas and red light panels and infrared light panels. You could grounding, like all that stuff is going to help energize the water, removing yourself or minimizing your non-native electromagnetic field environment, your wireless signals, like minimizing exposure to those because they've been shown to break down structured water. Minimizing your toxin exposure. Glyphosate has been shown to break down structured water in Dr. Pollock's lab. So that's just an herbicide that is commonly sprayed on things. So there's lots of different things that you can do to optimize that. And then there are devices, there's water filters that you can get that will, detoxify, remineralize, and structure your water or energize your water. They can be pricey and you don't necessarily need them, but they can be very useful. They can be handy because then you can just put your water through that and here you go, you got it. Um, and then if I'm traveling, I'm drinking water like spring water, from in glass bottles, different things like that. And like you'll see me, I'm swirling it around in the thing, in the water bottle. So yeah, you want to get good water because we need the raw material to make
Yes.
structured water in our bodies. So, but we can treat our bodies too and increase. Now the other thing is that everybody thinks that mitochondria's job is to make ATP, and it does make ATP, but ATP is not the energy currency of the cell. And the mitochondria have other jobs. It makes heat in the form of infrared light, which infrared light is the most structuring to water. So that's the body heat that you're emitting is infrared light. They emit CO2, the mitochondria do. And then also your mitochondria make a byproduct of water. And this is like metabolic water is what I would call it. And it's the perfect energized deuterium depleted water. So if you have optimal metabolism, you are making more energized like or structured water for your cells. So achieving metabolism means getting your light environment right, optimizing circadian rhythm, and eating a metabolically healthy diet, which is generally lower carbohydrate, but doesn't have to be no carbohydrate. It just means a diet that makes you metabolic. So really, just eat whole foods. Like that's the main premise: is eat whole foods.
Yeah, that's what I always say, just the single ingredient foods.
Mhm.
So if you were to eat a carbohydrate such as sweet potato, it's better than eating bread, pasta, or
Oh
bagels,
yeah.
any of that. Um, okay, so that's how you structure water, and that's important. And as for grounding, I wanted people to know what grounding. How do you ground? Do you just put your feet on, like
Directly
just
on the
on the
earth.
soil? Yeah,
Yeah. So grass or dirt or whatever, those are very conductive.
sand.
Sand, yeah. My feet are on a grounding mat right now because
Oh,
you
okay,
can
so you
do
have a
some
mat.
indoor grounding. Yeah, I have
Yeah.
grounding sheets because so let's talk about grounding. So what is grounding? So grounding is basically the conduction of electrons, it's very low voltage electricity from the earth into our bodies.
Hmm.
So, you know, lightning is striking the earth. So the sun is concentrating energy into the ionosphere. And the ionosphere gets excited during the thunderstorm, and lightning strikes the earth, and the earth discharges that energy into the
That's right.
earth. And that makes the earth very electronegatively charged, this huge store of electrons. And the laws of electrostatics tell us that if two conductive surfaces are connected to each other, then the area of higher concentration of energy will flow into the area of lower concentration. And I'm never going to be as concentrated in energy as the earth, so it's always going to flow into me if I have bare skin contact with the earth, or even like an organic material through your clothes, like it'll conduct through that as well. And so as much time as you can spend outside in contact with the earth, the better. But wood is not very conductive. So touching the bark of a tree is not that conductive, or standing on roots, or on mulch is dead wood. It's not very conductive. But if you touch the leaves of a tree, you're conducting and you're grounded. Um, and concrete is somewhat conductive. So if you're standing on like a concrete patio that's maybe 4 inches or less and it's directly on the ground, you're probably conducting. Asphalt's not conductive. There's rubber in that, and that's preventing that from happening. So different things you can do, but also you can buy these indoor grounding mats. So if your home has a grounding wire, which most modern homes do, older homes, some of them don't, but if you have a grounding prong in the outlet, you can buy devices that plug into that and connect to the ground and then conduct into the home, which is my feet are on one of those right now. And I also have sheets that are plugged into that. So I sleep all night grounded. So lots of different ways you could increase that. But as much time as we can be in contact with the earth, the better.
Okay, yes, because of course most people probably want to know how they could do it in the most cost-effective way. So go to a beach, go anywhere where there's grass. I mean, how do you feel about putting your feet on grass where they typically spray a lot of stuff on grass?
Yeah, it's not ideal. I don't know if I would do some grounding on a golf course. I don't think that's a good idea,
Yeah, exactly.
You get a lot of toxins. So yeah, I mean, ideally it's not been heavily sprayed with stuff.
Or with
But
anything at all.
with anything at all. Yeah. So that's important. But the, I guess the most grounded you could be is in a natural body of water. So if you swim in a lake
Mhm.
or river or whatever, like your whole body is grounded, and water is incredibly conductive. So it's conducting right from the earth. So swimming in natural bodies of water is very, very grounding.
That's why everybody does so good at when they're at the beach. I
Hmm.
mean, being at the beach, going in the water, having your feet on the sand.
Hmm.
That's why everybody feels good. That's why they say, yeah, I went on vacation. I came back. I felt so rejuvenated.
That's right. In the sun, in the water, and like in the waves are crashing, structuring the
That's
water.
right. Structuring the water.
You're
That's
hearing
right.
a noise like that, and natural noises. Like, yeah, it's just very common. There's a reason we go to those places. I think it's
That's
funny
actually
that we call it recreation. We're
it's literally you are
recreating
recreating.
the natural world of a human. When we go out and we go into nature, we recreate.
Yeah, because so I love the beach, and I always say I belong to the beach. And everybody asks me like, "What's the big deal?" And I tell them exactly that. I'm like, "Well, where you're grounding, when you're inside, like when you're in the ocean, you're actually absorbing so many minerals through your skin, where most people are
Oh yeah.
mineral deficient. So you're absorbing a lot of that. It's detoxifying. You're taking in so much of the sun, which helps you convert into vitamin D, which is known to help your immune system. You're also getting this full spectrum of light, especially the infrared. I mean, the Mother Nature left nothing to
Yeah.
chance.
Well, I
It's
mean,
all
we
in
grew up
there.
outside, but we evolved outside. Humans have been outdoors for, forever. And so it makes sense that our physiology would learn to use those things of being outdoors. So we remove ourselves from those things and our physiology suffers. And that's what's happening. That's exactly what's happening. Eating unnatural food under artificial light, removed from contact with the earth, toxic, stressful relationships, like it's just all these things. Like this is why we're sick. It's very, very obvious. We have to recreate nature within the confines of our modern day lives as much as we can. It's like obviously I can't go live back in the woods. I mean, I could, but that wouldn't be the greatest option for me. So I recreate it as much as I can. These lights around me are all incandescent infrared lights. I'm blocking the blue light with blue blocking glasses because it's after sunset. The blue light is turned way down on my computer. My feet are on a grounding mat. You know,
Mhm.
these are things that I'm able to do to recreate a more nature-like environment for myself, and I do them as often as I can to help my body maintain its health.
That's right. And also light from a flame. So,
Hmm.
I mean, of course, don't go lighting any of those scented candles and inhaling all the
Yeah,
chemicals.
yeah.
But a nice candle made with beeswax is actually great. The scent is beautiful, as well as the benefits of the light itself. Um, I actually, some of the schooling that I've done, actually, that's how they taught us to meditate. Basically, just look at at the flame and just stare at it for as long as you can. And it was just one of the most mystical, amazing things ever. It is just so, it touches the soul.
Hmm.
So I wanted to touch on all of that. Let's talk a little bit about as we're closing about the circadian rhythm so that people can understand
Mm.
what you mean by that.
Yeah. So this is probably one of the most important things I think to do
Yeah,
is sync your body up to the day night cycle. Because I mean, every single cell in your body is trying to tick on a 24-hour clock, and it's going to do that regardless. But
yeah.
it can be disrupted from external signaling, and the main one is through our light environment. So light is what tells your body what time it is. Specifically, how much blue light is available is what tells your body what time it is. So when the sun rises, it peaks over the horizon, blue light spikes, and that tells your body that it's daytime. Your body makes cortisol, wakes you up, and you're up while blue light is out. And then blue light slowly rises throughout the day and it's highest at solar noon. Like the red and infrared light stays the same. When the sun is up, it stays here. But the blue light
Mhm.
changes. The blue light goes high and it gets highest at solar noon. And then as it comes down, it gets lower and then it goes away. And then all light goes away after sunset. And so when you get the darkness signal, that's you're supposed to make melatonin from that darkness signal. And the cortisol goes down, melatonin goes up. And the melatonin is what tells your body to A, go to sleep, but B, I say clean house while you're asleep, basically repair things, detoxify, all that stuff, autophagy, mitophagy, all these cleaning house type things that are supposed to happen if we have enough melatonin. If we have artificial blue light on after sunset, that entire process is shut down. And it doesn't start until we turn the lights off and go to bed, potentially 10, 11 o'clock, whatever it is, whenever people go to bed. I'm a little earlier than that, but if that doesn't happen until then, we've missed out on all this melatonin and it's disrupting our circadian rhythm. Now we don't sleep very well. We don't have the deep restorative cleansing sleep like we're supposed to. We may wake up in the morning and be dragging, and then we're reaching for the coffee and things like that, trying to get ourselves going in the morning. It's all because it's disrupted circadian rhythm, but it's way more than that. It's not just about optimizing your sleep and getting good sleep. I mean, that's important. But again, the arteries don't repair themselves if we don't have adequate melatonin when we sleep. the gut doesn't repair itself very well if we don't have adequate melatonin when we sleep. And there's mitophagy and autophagy don't happen very well, which is the killing off of old cells and old mitochondria to make new healthy ones. And if you don't do that very well, then you're more predisposed to cancer because old dysfunctional cells become cancerous. And if we don't kill those off and make new healthy ones, they can stick around. And there's a heavy link in the literature to disrupted circadian rhythm and heart disease, not just heart attacks, but vascular disease. There's a heavy link to breast cancers and prostate cancers, disrupted circadian rhythm. So this is incredibly important to do. Our light environment is very, very important to pay attention to. And I like to say that everybody talks about food and nutrients. Well, light is a nutrient as well. And
Yeah.
light is the nutrient that tells you what time it is. And you need to tell your body what time it is and sync it up to that day night cycle. For however many millions of years or however many years you believe humans have been on Earth, the only light we had was sunlight and fire. And
That's
fire
right.
was not enough. It's not enough blue. It's a very small amount of blue light to signal any to disrupt circadian rhythm. Incandescent bulbs, like I have on here, they kind of mimic fire. They're the kind of same process. But the fluorescent light and the LED lights and the screens, they're incredibly disrupting circadian rhythm, and it's a huge issue.
Yeah, so there's I would recommend that people go and do research on this. So there was a study done on, I believe it was nurses only, but I'm not 100% sure, who were working shift
Mhm.
and breast. So it was about breast cancer. And
Mhm.
yes, I mean, the numbers were astronomical. And I remember when I was in school, uh, they were showing us. So there was a video, and I don't know if it's still on YouTube or not. So they were measuring somebody's melatonin levels so they were in a completely dark room, and then they made a pinhole. It was this tiny, tiny little hole, and a beam of light went through this ridiculously very thin pinhole, and that you they were measuring the melatonin as it was dropping because of
Mhm.
that light.
Yeah.
As soon as it hit the skin, you could see that the melatonin levels were going down. It's fascinating. It blows my mind because I know that people are like, "Oh, I fall asleep with the TV on." I'm like,
I know.
"How?
Yeah.
How does your body go into rest mode when you have blue light plus sound blaring at you and the blue light just hitting every surface of exposed skin?"
Yeah. Well, and with that on like that, they may be unconscious, but they're not getting into deep restorative sleep.
So the
Um,
body itself, the cells and the
and I
systems are not.
guarantee those people wake up in the morning and they do not feel rested most of the time.
Yeah.
And yeah, they're not cleaning house while they sleep and everything. Yeah, and like the three things that seem to matter most for light signaling is blue light is the main one.
Hmm.
So blue light is what triggers what time of day it is. But green and violet also seem to do so a little bit. Um, but blue is the main one. If you do anything, you block the blue light, which is what these orange glasses do. But you can get red glasses, and that will block the green light too, and also the brightness of light. So, if you can't buy glasses and if you can't buy incandescent bulbs, the least you can do is keep the lighting lower at night. Keep it less bright, which means no screens, which means only like lamps at chest level or lower. Like that's the very least you can do. Then do that. But yeah,
Especially for those people that work in offices and they're exposed to those fluorescent lights for 7, 8, 9, 10 hours, however long. Oh,
yeah.
I know that oftentimes people who work in offices are glorified, and people who work outside, construction workers, are looked down on because they don't have these fancy jobs. In the meantime, they have natural sunlight, they get
Mhm.
movement, they're exposed to the cooler air. So
Mhm.
yeah. Wow, thank you so much. This is like a masterclass. Thank you so much for everything that you shared. Um, let's tell the audience, where can they find you? I know you have courses
Mhm.
and of course your books. So let's talk about where they could find you on socials, your website, some of the courses, if you can touch on those so that people can learn at least what you said about heart attacks, how to prevent them, about how the heart works, what it is, so they get more in-depth knowledge. So when they go to their doctor, they can actually say, actually, you got this all wrong.
Yeah. So yeah, my website is resourceyourhealth.com. And everything I'm about to tell you about is on there, aside from me on social media. That's other things. And my social media handle is Dr. Stephen Hussey, Dr. Stephen Hussey, and that's Stephen with a PH. So you can find me on social media. You can reach out to me there. My website is resourceforhealth.com, and my books are on there. My health community is on there. So I have a health community that's only $20 a month to join, where you can, have access to things and ask me questions and things like that through there. I do like biweekly Q&As and things. And yes, I do have the courses, and the courses are on my website. And some of my courses are, I have like a metabolic reset where I talk about diet and circadian rhythm. I have a truth about cholesterol course. I have a building healthy arteries course. I have the truth about heart attacks course, which there's many different types of heart attacks that can happen. Some of them happen with no blockage whatsoever, which is very interesting. And then I have a true function of the heart course, where I talk about how the heart is not a pressure propulsion pump and what the functions of the heart are. So all those courses are available on the website. And just so people know, if you're part of my health community, for $20 a month, the courses are much cheaper for those people in the health community. Like I would say like over 70% cheaper in there.
Amazing.
So just so people know, you could do that, but you could also just take them on the website as well. But and the courses are probably my most up-to-date literature. My books are pretty up to date, but the courses are probably the most up to date as far as like everything that I've learned. So yeah.
I think it's important to just join your community because at least even if they don't understand something, they would have the opportunity to ask you so that you can clarify. So there you have it, everybody. That's where you can find the amazing. My God, you are so. I had no idea. You're just brilliant about all of this. I mean, people, you should be so much bigger than you are on Instagram. Maybe I hope you have bigger channels that actually help you spread the word so that at least people can learn about heart health, especially with heart disease being the number one killer in the world.
Mhm.
You have so much wisdom and so much knowledge, and people would benefit so greatly from learning. At the very least, if they think that they have any kind of genetic predisposition, or that they've already had a heart attack or two, or they've had any kind of surgical interventions to fix what they think is caused by eating too much fat,
Mhm.
their cholesterol being too high. Um, so there you have it, everybody. I'm going to, of course, put all of this information in the show notes. But thank you so much. This was just so fascinating, so much information. I deeply, deeply appreciate you coming and educating the audience. And I would love to have you back so we could talk in more depth because you seem to do a lot of research and to learn a lot. And you gave away all of the most important lifestyle factors that actually can help people reverse all of the stuff that they are afflicted with. So thank you so much, Dr. Stephen Hussey.
Yeah, thanks for having me on.
And everybody, thank you so much for tuning in. We will see you on the next show. Please go like, share, especially this episode, because I'm sure that you know somebody who's sick or has some sort of heart disease, cardiovascular disease. They all fall under the same thing. Even people that have strokes or are predisposed to strokes will actually benefit greatly from this because he talked about the viscosity of blood, and that is important. So we will see you on the next episode. Thanks for tuning in.